Hello, you are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Okwan. Today's section, I'll quickly run with you the Maxillary Nerve. Now get to know that the Maxillary Nerve is actually the second division of the trigeminal nerve, and that's the fifth cranial nerve. And of course, you already know that emerging from the ventral aspect of the pons, the only nerve coming out over there is the trigeminal nerve. But my friends, through the trigeminal ganglion, we have three divisions of this nerve. And these three divisions, they are what we call the first division. Already we've done it. That is the ophthalmic nerve. So please, if you've not watched it, please get that video link. And that nerve, yes, it's actually the thinnest, division as far as the trigeminal nerve is concerned. Then of course, we said that it ran through what we call the superior orbital fascia, but before it goes there, it gives of those three divisions. We talked about the lacrimal division, we talked about the frontal division, and of course the nasolacrimal division. Then of course, we also said that the thickest or the largest division of the trigeminal nerve, yes, which we've already done it, that's the third division, that is of course the mandibular nerve. Okay, we said that mandibular nerve, yes, will leave the cranial cavity through what we call the foramen ovale. But of course, the intermediate one, by way of size, leaving the cranial cavity, okay, through the foramen rotundum, is what we call the second division of the trigeminal nerve. And that's the maxillary nerve we are going to do today. Now, the course and by way of what the maxillary nerve is going to supply is pretty simple. All that we need to know, okay, is to know what happens to this nerve, okay, as it's in the cranial cavity, okay, just before it leaves the cranial cavity. Then of course you have to know what happens, okay, in the infratemporal fossa. Then we have to also know that this nerve, the name is maxillary nerve, so it will be running above or going through the roof of the maxilla. And by way of talking about the roof of maxilla, we know we are talking about the floor of the orbit. So we should be able to tell all these important relations about this nerve. So my friends, at the end of this section, you should be able to tell the complete story, okay, behind this maxillary nerve. And so, without much ado, let's set the ball rolling. So there we are, a very simple schematic diagram, okay, to represent everything that we have to know about this maxillary nerve. Okay, so as I told you, from the trigeminal ganglion, yes, we have three divisions. Of course, the first one is of course the ophthalmic. The third one is the maxillary. Yes, I'm talking about the second one, where is the maxillary nerve. Okay, imagine continuing anteriorly forwards over there, I have this nerve. But my friends, it wants to leave this cranial cavity or this cranial fossa, okay, through a foramen, which you call a foramen rotundum. But before it goes through, this foramen rotundum, it gives a branch to go back, okay, to where it came from, to the cranial cavity once again. And by way of our principle, it is going back there to supply one thing only, supply the meninges. And that is why this branch over here is known as the meningeal branch of the maxillary nerve. Then beyond that, it goes out of this cranial cavity through the foramen rotundum. But my friends, once it comes out, okay, it will be topographically connected to a ganglion. Now, out of the cranial cavity, this area over here is known as the infratemporal, fossa. My friends, in the infratemporal fossa, located specifically over there, is the pterygopalatine fossa. And in the pterygopalatine fossa, we find a ganglion, one of the parasympathetic ganglia that we find over here. Okay, this ganglion is known as pterygopalatine ganglion, otherwise what we call sphenopalatine ganglion. And my friends, what happens is that this nerve, where is the maxillary nerve beyond, okay, the foramen rotundum, will be topographically connected to it. Now, for you to really understand these things, I'll be doing, essentially very pretty soon, I'll be looking at the secretomotor pathways of the major glands in the head and neck region. So once I look at that one with you, you'll be able to understand why I talk about this kind of nerve being topographically connected to these ones and all that. But one thing I want you to know for now is that this maxillary nerve, after going through what we call the foramen rotundum in the infratemporal fossa, specifically in the pterygopalatine fossa, the ganglion that will be topographically related to it will be what we call pterygopalatine ganglion. Now, beyond that, one thing I want you to know is that this nerve, it wants to go into what we call the roof of the orbit, the roof of the maxilla. And my friends, as I told you, I said the roof of the maxilla is essentially the floor of the orbit. But before it does that, before it goes through, it will go through a fissure over here, which we call it infraorbital fissure. Okay, inferior orbital fascia. Okay, that is what we find over here, inferior orbital fascia. Now this inferior orbital fascia, as I can see, this nerve, which is the main trunk of the maxillary nerve, it gives 3 branches. Okay, 1, 2, and 3, but 2 of them are entering, okay, through this inferior orbital fascia. The third one is going outside. I will explain that one to you. Now let's look at the first one, which goes upwards, okay, through this inferior orbital fascia. The first one is known as the zygomatic branch, okay, or the zygomatic nerve. Now, my friends, you've heard of the zygomatic branch of the facial nerve. Now, that's not the one we are talking about. This one also gives a zygomatic branch. The maxillary nerve gives a zygomatic branch. And my friends, that nerve will give rise to 2 other branches. And these will divide into 2. And these are what we call the zygomatico-temporal. Okay, as well as, of course, zygomatico-facial nerves. We will look at this one. These nerves, these connections are very important. Okay, they are very important. We will look at them later. So that is what we see. Now, the second division, which is running through the middle, almost middle aspect of this inferior orbital fascia, okay, is what we call infraorbital nerve. Now, the name is called infraorbital nerve. Now, please listen. Before it divided to these 3 branches, okay, the name was actually the maxillary nerve, okay, but once it goes through what we call the roof of the maxilla, which is essentially the floor of the orbit, okay, so floor is low, so orbit has to do with the orbit, yes, the floor of the orbit, the lower aspect of the orbit, okay, so we call this nerve infraorbital nerve. So from the level of the inferior orbital fascia all the way to the exit point, and my friends, the exit point is known as the infraorbital foramen, okay, it's known as infraorbital foramen. Now remember that we saw there was what you call in the upper orbit, we have what you call supraorbital foramen, which of course the nerve which will be running through it will be the supraorbital nerve. So the nerve which will be coming out, okay, through this foramen will be called infraorbital nerve, and to be running through the foramen known as infraorbital foramen in the maxilla. Okay, so that is what I want you to know. So my friends, it was maxillary nerve up to this point and beyond, okay, from the level of inferior orbital fascia up to the level of infraorbital foramen, okay, the nerve will change its name. It will be called infraorbital nerve, one of the divisions of what we call the maxillary nerve. And my friends, what happens is that as it runs through what we call the maxilla, okay, what happens is that it will give some branches. It will give 2 branches in there. And what are these 2 branches? Going to supply what we call the anterior and the middle aspect of the teeth in the maxilla, okay, and as well as the gums, the gingiva over there. And what are these branches? The first one, okay, is the middle one, so we call it middle superior alveolar nerve. Now my friends, when we reviewed the mandibular nerve, so if you're not watching, please get that video link. Now when we reviewed the mandibular nerve, there was 1 branch, okay, from the posterior division, okay, which actually went to supply, okay, the gums and teeth of the lower teeth, okay, in the mandible. Okay, so those ones were called the inferior alveolar nerve. But my friends, over here, these ones will be called superior alveolar nerves. But my friends, there's a catch. The catch here is that we have different kinds. This one is going to the middle aspect over here, so we call it middle superior alveolar nerve. Then there will be another nerve over here, which we call it the anterior superior, alveolar nerve. They are both, superior alveolar nerves, but one is in front, so anterior, one is in the middle. That is going to be the superior alveolar nerve. But my friend, how about the posterior alveolar nerve? The posterior alveolar nerve, yes, that one is the third one, which doesn't go through this inferior orbital fascia, and so that one runs, okay, backwards over here to supply, okay, from the infratemporal fossa only, it comes backwards to supply the posterior teeth over here. Okay, of course, talk about the molars and then the premolars over here. So that one is called the posterior superior alveolar nerves. But my friends, the other one which supplies, okay, the maxillary sinus, okay, the largest sinus that we have over here, is what we call the middle superior alveolar, because the one which runs through this, maxillary sinus, so it supplies it as well. But one thing that you have to know is that this nerve, which we are calling it, infraorbital nerve, yes, as it leaves this infraorbital foramen, yes, it gives off these 3 branches. And what are these 3 branches? Going to supply the lower eyelid, so that will be a palpebral branch, yes, the nasal branch, and of course the upper lip, okay, we are going to have what we call the labial branch. Okay, so by way of look at how they are connected in the body, okay, the lower eyelid, palpebral branch, then go to the nose area, So the nasal branch, and then go to the upper eyelid, being what you call, upper lip, which being the labial, branch. Okay, so that is what we find over here. So my friends, this is a pretty simple, pathway. I mean, it's very simple. Okay, so the essential thing, what have we seen? We said there's the trigeminal ganglion, okay, and emerging from the middle aspect. Okay, going forwards, we have what you call the maxillary nerve, which will give a recurrent branch, okay, being the meningeal branch, okay, to supply the dura mater or the meninges over there. Then it leaves the cranial cavity through foramen rotundum. Then in there, it meets what you call the infratemporal fossa, and specifically in the infratemporal fossa, topographically connected to this nerve, okay, will be the ganglion, okay, which we call the pterygopalatine ganglion, otherwise known as sphenopalatine ganglion. And then this maxillary nerve continues, okay, and then it continues, okay, it wants to go into what we call the roof of the maxilla, or what you call the floor of the orbit. But before it does that, it divides, okay, so that it gives us one branch which goes upwards, the zygomatic branch, which eventually divides into two, which is the zygomatico-temporal and of course zygomatico-facial branches. Then before it goes there, okay, it goes into this fascia. Yes, it gives a branch to go backwards, supply what we call these teeth over here in the posterior aspect over here. So that's why we call it posterior superior alveolar nerves. Now remember that the alveolar nerves over here, they are all superior, okay, but the catch here is that unlike in the case of the mandibular nerve, which we had only what we call inferior alveolar nerve, this one we have what we call one in the anterior aspect, in the middle, and then the posterior. Remember that the posterior one is a direct branch coming from the maxillary nerve before entering what we call the inferior orbital fissure. But my friends, one thing is that the anterior and the middle superior alveolar nerves, they are branches coming from what we call the infraorbital nerve, which is also a branch of the maxillary nerve. Okay, but all these things, if it's an MCQ exam, we will ask you specific questions and you should be able to tell the details behind these ones. But my friends, after this infraorbital nerve leaves, okay, through what we call the infraorbital foramen, it gives off these three branches to supply, okay, the important glands over there, as well as of course the skin and mucous membrane over there. Talk about of course the palpebral branch, okay, lower eyelid, okay, talk about the nasal branch. We talk about of course the upper lip over there, that's the lacrimal gland. As I told you, it is only the middle superior alveolar nerve which runs through this maxillary sinus, and therefore that's the largest sinus, and therefore is the one which supplies the maxillary sinus. Alright, I hope you find this meeting helpful. Okay, so please get ready for all these nerves. Okay, we look at all their pathways. We'll bring in the scleromotor pathway of these major glands in the head region, okay, for your complete understanding. I'm very grateful for your time this evening. Have a good night, and may the good Lord richly bless you. Amen.